the better, the best that we have as far as our teaching diplomats. I'd like to welcome back Dr. Tim Francis, and he's going to talk to you about the 12 cutaneous regions, a review of the meridian system. Pay attention. The weakness in my view and what we do in applied kinesiology is the application of meridian acupuncture, and none better than Dr. Tim. Go ahead.
Thank you, Dr. Tom. It's great to see so many old friends and students, patients, and new friends, hopefully. This is actually historic. This is my very first PowerPoint presentation.
And it was painless.
Well, no. Yeah, my computer's lucky to still be alive. But anyway, I hope you enjoy it. I had some help, I will admit, with this from a dear friend of mine, Aviana, who some of you know. And but we got through it. This was actually last year's paper, but for various reasons I did not present it last year. So we're going to present the paper first and then do a meridian review. So what are the 12 cutaneous regions? They are surface segments on the skin that are projections of the meridians. They function to protect the body and regulate sweating, mainly through the lung meridian. These are accessed through therapy localization to the pulse points, but only in the standing position. So if you check the pulse points, seated, supine, they're negative, have them stand. If they're positive standing, you have a cutaneous region issue. Now, what I like to do, because I have about 2 to 3 hours of material to lecture in 1 hour, so I'm going to try to keep it down to a user-friendly. It doesn't, in my opinion, do any good to learn a lot of theory if you can't apply the theory. So the same process that I would use in teaching my basic course, I'm going to use today, so that when you leave here, you can do, there's actually about 7 or 8 meridian systems. Now, how many here are not familiar with spinalogenic concepts? So just think of it simple. Take a transparency of the cervical spine laid across the upper thoracic. Okay? So C1 would be T1. So C7 would be, okay, let's keep it that simple. All right, now, the way that you fix the cutaneous channel is via the spine. And let's say, for example, you had negative pulse points seated, positive pulse points standing. So you get, let's say, for example, of the classic 3, the left middle pulse point, TL, standing only. TL, the alarm point standing, let's say it's the liver. Okay. The muscles will only display weakness while the patient is standing. Kind of hard to test the PMS standing, but you could easily do a rhomboid. Okay. So the way to fix it is, tell me, what's the associated point for liver meridian? T10. Okay. What's its lobit? T1. What's the spondylogenic?
C1.
C1. What's its lobit? L5. That's the one you adjust. Got it? You adjust L5, but we always look, like Scotty taught us, look for oceans of emotions. So we do encoded memory technique. So we adjust L5 with encoded memory technique. Who is not familiar with encoded memory technique? Thank you for being honest. So encoded memory technique is you make the adjustment the same way you normally would while the patient brings up to neurocognitive awareness the particular issue in the tissue. So as Scotty taught us, money, love, and you. Okay, and then you can find the emotion, have them hold that while you set the bone, That's encoded memory technique. Okay? Now, interesting, although the muscle will only weaken while standing, if you have them sit, lie down, there's a new muscle testing procedure. It's called test and rest. It's not repeated muscle activation, patient-induced. It's not aerobic, anaerobic. You need to test the muscle and rest for about 3 to 4 seconds. Test it again. Sometimes it'll be weak, usually not. Let it rest again. Test it again, and then it's usually weak on the 3rd or 4th test. But you have to rest 3 to 4 seconds to find it that way. It's very interesting. Okay? Now, the meridian system is composed of, from deep to superficial, divergent, extraordinary, the deep collateral, the primary, the muscle channels or musculotendinous, the connecting channel proper, then the superficial connecting channels, and finally the cutaneous channels. So we have these regions: greater yawn, lesser yawn, bright yawn, terminal yin, lesser yin, and greater yin. So sometimes you'll see a dermatitis pattern that will fit one or more of these areas. And this may kind of tune you in that you may or may not have the cutaneous channel issue. Okay, now, according to Machio Chia, it's a textbook that I really like, it is due to the relationship between each cutaneous region and its corresponding channel and organ that we can affect and regulate the internal organs. The cutaneous regions may reflect an inner disharmony which is treated centrifugally from the cutaneous to the main to the deep connecting and finally to the internal organs. Now that's just kind of goes over what I'm going to show you right now. So, and I kind of picked my pigeons, if you will, because I have limited time. They all worked out except for one. He kept changing every time I would check him, so we threw him aside. And where'd he go? Oh, Rob. Yeah, come on up. And even in orthodox AK, if you will, the doctor is allowed to TL acupuncture points, and that's where I'm going to do it. So we're going to take just an arm here, a general test. We'll check the pulse points here. I don't find anything. We'll check these guys here. And so I don't find them in the clear. Now, he could have an atlas, as you know from the basic course. We could check that. Take a thumb TL to your left, or right atlas, rather. And push up here, and take a thumb TL to your left atlas. Anyway, at least I don't find it that way, okay? Now, let's do it in a gait position. So let's just see, lift your left knee up. So he's in a left foot forward gait, that doesn't do anything. Lift your right knee up. So just the gait position doesn't do anything. If we TL the pulse points, lift your left knee, I don't get anything there. TL the pulse points, lift your right knee. And I actually don't get anything there either. And I just realized I'm starting to talk about the muscle channels, and we're on the cutaneous. Love these PowerPoints. So, where's my skin guy, which is a different guy? And actually, he just changed. Come on up. Just hold that thought about the gait position. It's got nothing to do with the cutaneous. Have a seat. Can you roll these up a little? Bring this up here. Bring this up here. Push. Okay. So we're going to TL. I don't find anything. We're going to TL. Then I don't find anything. Go ahead and stand up. I don't find anything. Again. So I find something on the right wrist. So I find of the classic three, the right middle pulse point, which as you know is earth, stomach, spleen. Okay. So, actually let's put this back just a little bit. Okay. Now, standing, I'm going to TL the alarm point for the stomach. You take a few. This way. I don't find anything. We'll go spleen. It's hard to find. I don't find anything. And I find standing left spleen alarm point. Now, bring this back here and pull back. Pull back. So I find a right middle trap, actually, and a left middle trap. Now, how would we fix that? What's the associated point for the spleen? L2. Is it?
L1.
No, it's T12. Let me see if I can catch anybody. Isn't it 12? Okay, so what's its love? 6. What's its spondylogenic? 6. And what's its love? 5. Okay, so we would adjust T5 with encoded memory technique. Okay, got it or no? Okay, so you go to the associated point, go to its Lovett, go to its spondylogenic, go to its Lovett, and you adjust that with encoded memory. Okay, now, have a seat. We're going to do that in just a second. Push back, and you don't find it. Let it rest. Push back, and actually that was only one test. Sometimes you'll see that. Push back, let it rest. And you have to really let it rest. Push back, and that's also only one test. So sometimes it'll be 2, most of the time it's 3 or 4. Okay? So let's go to put your hand on your forehead. Okay? So think about money. Think about love. Think about money. Okay. So think about money and low self-esteem. Okay. Is there an original time? Preconception, at conception, conception to birth, birth to 10, 10 to 20, 20 to 30, 20 to 25, 26, 27, 28, 27. You were 27. Can you think of something at 27? When you finished school, started your practice, broke his health. I can relate to that. Okay. Can you think of that? Think of that. Think of that. Okay. So I'm going to adjust T5 while you hold that thought. Okay. Is that okay with you? Oh, by the way, this is a demonstration, not a treatment. Just want to put that out there. Okay. It only takes one. Lay this down. Push up here. So I think it's this guy. Is that him? Oh. Push up here. Okay, so I am actually going to take it as an anterior, and he's a pretty big guy, and I'm a pretty big guy, so we're going to do it on the floor. I don't want to break my table. Have a seat there with your feet that way. And Let's have you cross your arms this way. And drop your head forward. Now when I tell you, hold that thought at 27, can you do that? Okay, roll you back. All right. Oh my God. All right. Okay. Now, think of that thought. It's easier in the office. Does anybody, you mind if I take, I can afford one. Let me take this off because I'm already hot. I'm just getting started. All right, have a seat. So we have the earth element. Stand up. And that's gone. Pull back. And that's gone. Pull back. Can you think of 27? Money and low self-esteem? So again, I want you to be able to take this and run with it. So how do we find an involvement of the cutaneous regions? You tell me. Negative TL seated, positive TL standing, muscle weak standing. In any other posture, it'll be weak with test and rest, and test and rest. And then, okay, then you find the associated point, go to its love, go to its spondylogenic, go to its love, and you adjust that with encoded memory. Have you got it? Jane?
What symptomatology would they present with that you would consider doing?
Sure. Any type of dermatologic issues, anything. A lipoma, psoriasis, eczema, anything. Vitiligo, anything. But you just check it. Okay? Anything else? Have you got it? Can you do it? Can you find it? Can you fix it? If not, you got the paper, you got me. Okay, so now we start a review. You got the cutaneous?
Yes.
Okay, no, maybe. All right. So really, acupuncture is what Dr. Mladenoff was trying to tell us in his lecture yesterday morning. It's all about what? Balance. It's all about balancing yin and yang. And it's definitely interwoven with Chinese philosophy. Now, you may not know this, there are actually 4 types of qi. So there's primary, pectoral, nutrient, and defensive qi. Primary qi is congenital, it takes root in the kidneys. They call it the moving mean between the kidneys. And what's in our ICAK logo? The psoas muscles. What are the psoas muscles ready to? In the kidneys. I test the psoas muscles on every patient, every visit, unless they're like 2 years old. Okay? Next is pectoral qi, that's inhalation in food, affecting by the heart and lung meridians. Nutrient, again, is from food, stomach and spleen meridians. And then the last type of qi is defensive, that's from food, and that circulates outside the blood vessels. Do you think maybe diet might be important to discuss with your patients, considering the 3 types of qi involve food? You bet. Now, according to Manaka, qi does work, is the result of work done, and is the medium of regulation. Therefore, qi is information. It's an informational system that refers to both energy and matter, and yet it is neither. It is any pattern of events in time and space that is a measure of order in a system. Order is a degree of structure. An open system is a system which exchanges information with its environment. Isn't that the human body? It's an open system. Now, Qi is either yang, moving and warming, or yin, nourishing and moistening. If the balance between yin and yang is not maintained, resulting in excess or deficiency, then disease is produced. What's chiropractic? Too much or not enough is disease. It's the same. Okay, according to the miraculous pivot, so important are the meridians and collaterals which determine life and death in the treatment of all diseases and the regulation of deficiency and excess conditions that one must gain a thorough understanding of them. Now, how important is that? Well, suppose you're a chiropractor that's been in practice 3 months, okay, and you happen to have taken somebody's course, not mine as a matter of fact, one of my former students, or he's still kind of a student. And the baby is born without heart rate and without respiration. And the midwife does resuscitation, but its vitals are still all over the place. Well, what if you could therapy localize the pulse points and you found heart and you adjust T6? And then you re-therapialize the pulse points and you find lung and you adjust T3 and all the vitals normalize and the baby goes on to become healthy. Okay, that wasn't me, that was this practitioner right here, Maddie Rickovic. And she learned that from Dr. J.J. Greger. So this can be, at times, life and death stuff. Do you think chiropractors should be allowed to adjust babies? Maybe a good idea. Okay. So there's an issue in Australia if you didn't know. Anyway. Nutrient Qi flows inside the meridians and defensive Qi flows outside the meridians, making the interior, exterior, upper, lower, right, left sides of the body in harmony and equilibrium. Therefore, the entire meridian system serves as a series of barriers to prevent penetration of pathogenic factors. The key point in acupuncture treatment is to know how to regulate yin and yang, and acupuncture treatment must aim at regulating the flow of Qi. So, that brings us up to the 15 collaterals now. So we're going to kind of go from the outside in. Now, the 15 collaterals, this is an older paper, and the function of these is to balance yin and yang in the limbs, and yin and yang for both the right and left sides of the body. It also balances yin and yang to the interior, exterior body, and it regulates yin and yang to and from the head. It changes the polarity between the elbows and knees, meaning in the fingertips. And the 15 collaterals are like a net covering the entire surface of the body. What does that sound like? Fascia. It sounds like fascia. And what is fascia? Fascia are collagenous fibers embedded in an amorphous semi-fluid gel, right? And Dr. Goodhart came up with his tincture palpation technique. Okay? Also, they cannot penetrate the large joints, meaning the elbows and the knees. That's where the Qi gets stuck. So here's just from deep to surface. On the surface should be listed cutaneous, and between the deep, low, and divergent should be listed the extraordinary. But we'll talk more about that later. Now, the only way that I know of how to access the collateral meridians is to do the pulse points wearing colored lenses. The colors are the same as the 5 element. So fire is red, earth is yellow, fire, earth. Metal, however, is violet. So fire, earth, metal, water is blue. Fire, earth, metal, water, wood, green. Okay, and then the midline points are actually indigo. Okay, here's Once you find it, the muscle will only be weak with the lens on. If you take the lens off, guess how it'll weaken? Pincher palpation technique. Okay. Now, for the lower extremities, you're going to adjust the knee. For the upper, the elbow, so upper meridians would be an elbow, lower would be knee. If it's the midline, that's going to be an atlas. Okay, and you need to adjust it with the lenses on. That automatically takes care of the emotion, so there is no encoded memory with the collateral meridians. Okay, so what would some of the symptoms be with the collaterals? Well, if it's superficial, so you have superficial, you have connecting, proper, and then deep connecting. So superficial would be like a lipoma. Okay, the connecting channel proper would be a cyst. And deep connecting, where you have stasis of blood, would be adenoma, carcinoma, fibroma, myoma. Okay? Now, let me just demonstrate this. So again, the collateral meridians, there are actually 3 layers, not important to know for application. You can only access them with the colored lenses. So colored lens negative, pulse point negative, but positive with the proper lens. Fire red, earth yellow, earth metal, violet, water blue, wood green, and then the midline or indigo. Okay? Midline atlas, upper extremity meridian elbow, lower extremity knee.
So you're going to go through every one of the 5 element colors to screen for this?
That's right. Okay, so where's my, I had my skin man, where's my collateral, there he is. Okay, Charlie, come on up here. And Dr. Grishkowiak, the other Dr. Grishkowiak, I'll have you stand here and then hand me the, so, if we check the pulse points, push up here. When we check the pulse point, push up here, real hard. And we'll start with fire, red. There is no orange, right?
Right.
Okay. So it doesn't seem to be fire. Earth is yellow. So do we need to check the left wrist? No, there's no earth element on the left wrist, right? It's only on the right middle wrist. No, so fire, earth, metal, which is violet. Do we need to check the left wrist? No. The metal element's only on the right wrist. Nope. Fire, earth, metal, water. Now do we need to check the left wrist? Yes. Nope. We need to check the left wrist? Yep. Oh. Push. Oh. There it is. Okay. Now I don't know if that's liver or gallbladder collateral, but we can check liver, gallbladder, liver, take them off. Put them on. Okay? So we have a liver collateral channel issue. Lay your back, please. And by the way, this is a demonstration. Oh. Take them off. Now, if we pinch or palpate, then you'll find it. Okay? So that's the correlation between the collaterals and the fascia. Now, is the liver meridian upper or lower extremity? Liver is lower extremity. And what big joint can't it cross? The knee. So we're going to take this. And let's just TL. We're going to TL maybe just the tibia here. Nothing. Let's go to the fibula. Nothing. Let's go to the tibia. Okay, so this is where the chi can't flow through the wood element. So I'm going to fix it. Demonstrate on it. Is it okay? Okay. If you're going to set a bone, honor your ancestors. And that's a little different. Now, if we take these off, and we pinch your palpate, and pinch your palpation as well. Any questions on the 15 collaterals? So negative color lens, negative pulse point, positive pulse point with the associated color. Fire, earth, metal, water, wood. Midline are indigo. That would be atlas. Upper extremity, elbow, lower extremity, knee. Okay. Aho. All right. This is big stuff, okay? Big stuff. Now, the muscle channels, and we know who that guy I thought was going to be, but I didn't find it. Anyway, the muscle channels, they function to protect us from trauma, but as Raymond Dart said, that George studied a lot of his work to get his original ideas, is that their main function is for the positioning of one bone to the other. They're for body movement of key, internal to external. However, this is very interesting, the muscle channels do not connect with the organs, but the organs connect with the muscles. It's a one-way street. So when they are reflected, okay, and if you put, for example, a weak pec major sternal, okay, and what we do, let's say you put bile salts on the tongue, and if the patient needs bile salts, you will get a response in the pec major sternal. But by treating this does not affect the internal organs via the muscle channels. But if you treat the organ, it affects the muscle channel. So, the way we access, we started off a little bit premature with that. Negative pulse points, but positive in a gate position. What was the original way that George found? He did it with BID, body into distortion. And then Dale Anderson, longtime chiropractor diplomate on the east side of town here, he came up with the Anderson protocol for the muscle channels. So mine's a little bit different. So this is similar to the correction for the cutaneous channels, only you have one less step. Do you remember the cutaneous channels? Associated point, go to the lobet, go to the spondylogenic, go to its lobet. Encoded memory, that's cutaneous. Okay. Muscle channels, just skip the last step. Associated lobet, spondylogenic stop. Adjust it with encoded memory. The muscles, however, will only weaken with aerobic testing, which is easy to remember. Muscles, what do? You work them out, right? So they only weaken on what? Repeated muscle testing. You getting it? Maybe?
Anaerobic or aerobic?
It doesn't seem to matter. Just do repeated muscle testing. So let me get Rob back up here. I don't know what happened, Rob, but somehow you changed from when we checked you before the lecture to when you walked up here. But That's the way around it is sometimes. All right, let's try this again. Push up. So negative pulse point, raise the right knee. I don't find it. Raise the left knee. So it's easy to put it, I don't find it. So something happened. I don't know, you don't have your phone on you, do you?
Nope.
Okay. Where's my original muscle man? The guy that changes every 5 minutes.
I did sit too close to him. That might have happened.
Did you really?
I stood all the way back there.
Okay, John, come on up. And if I can't find it, I think you've got the idea. But so check the pulse points. Negative, raise the right knee. High. Nothing. I think he's got a, yeah. So let's just do it this way. Okay. Raise the left knee. It's your fault. Okay. I don't find it, so I'm not going to spend all day on it, but that's how you find it. Negative, positive, and negate. How will the muscle weaken? Just think exercise, muscles. Repeated muscle testing. That's basic ICAK course, right? And then how do you fix it? Associated to the loved. It is spondylogenic. You adjust that one with encoded memory. Okay? So let's say you found wood and in a gait position, pec major sternal strong, but weakens on repeated muscle testing. Which bone do you adjust? So T10, its love it is. You guys, I know you know that. T1. And what's its spondy? C1. You adjust the atlas with encoded memory. It fixes it. Interesting. You take the repeated muscle testing, they'll strengthen with an oil, either omega-6 or omega-3, right? But after you correct it, the omega-3 or omega-6 will actually weaken your indicator. So it does a lot of internal corrections in the body. Don't take this as a side note. It's big stuff. Seriously, this is like big stuff, right? Dr. Maddie? Okay. All right, now, actually, honest to God, all of these were perfect. When I handed that little plastic thing, the flash drive. Anyway. Something happened, I don't know, but they were all lined up when I handed it. The primary channels, you all know, all the yin meridians begin and end on the chest and are the solid organs. All the yang meridians begin or end on the face and are the hollow organs. So this, I hope you have memorized, right? Not the numbers. What is small intestine? S1, right? Triple warmer. L2, right? So you know all those. Okay? And the way that I correct most of the meridian issues are with adjusting or with homeopathy. So we only use the 24-hour clock if what? This is a review, so I'm not teaching you the primaries. This is review.
Specific times of
So if you have, let's say, a pulse point, right? You have a weak muscle, but what happens? When you TL the alarm point, nothing, honey, right? It does not strengthen to the alarm point. That's when we go to the 24-hour clock, and what do? Put it in reverse and back up on the 24-hour clock, utilizing the alarm points, until we find the one alarm point that strengthens the weak muscle, right? That's the associated point we adjust, right? That's the one we give nutrition on. We do the low point on the first deficient meridian. Right? So I know it's a review, so, okay? And what about this? When do we go to the 5 elements?
One touching the
So, pulse point, right? but no weak muscles. So the easiest way, there are different ideas, but the easiest way is to go, let's say you had the water element. You don't find psoas or sacrospinalis or anterior tib. Okay? So you go forward on the Shank cycle, and let's say you found a weak pec major sternum. Okay? So you treat the element point on the deficient meridian. So you treat the water point on the liver meridian. Okay? And if you don't, it happens to be the tonification point, by the way, but if you don't know that, just go to the chart of command points. So you treat the element point. Where were we? Water. Right. So you treat the element point on the deficient meridian, liver 8, which happens to be liver 8. Okay. Now, if you go forward on the Shank cycle, you don't find it, then what do? Right. Go backwards on the co. So just go backwards on the co. Test the pec major clavicular middle trap. Let's say you found a pec major clavicular. You treat the element point on the deficient meridian. So you treat the water point on the deficient meridian. Where is it? Right there. Water point. So that one I don't know. You just look that up on an acupuncture chart. Okay. So when you go forward on the Shank, that's going to be the tonification. If you go backward on the co, just go to your chart of command points. Okay, I know this is review, and that's why we're not spending a lot of time with it. Now, there is one little trick that I want to show you, and then we'll move on to ones you're probably not familiar with, which are the extraordinary and the divergent. Where's my regular guy? There he is. Dr. Gary, you want to come on? Oh, not this. I'm sorry, Gary. There's another Gary. No, this is Dr. You got two Dr. Garys. Sure. Take your phone.
You're special, Gary.
Okay, so come on up here. So again, I'm just going to scoot back, bring this up. For sure. Okay, I don't find anything there. So I find something here. Okay, so I find the water element touch just above your pubes, about an inch above the pubes. Okay, so I'm finding bladder, which is different as well than what we found yesterday. I don't know what's going on here. So what would, this is not what I wanted to show you. What would you do next? You'd test what? You could test tib, you could test sacrospinalis, lay face down. This is not what I wanted to show you though. Bring this up here. Bring this back. Push back. Bring this back. Bring this back. Okay, so I've got a weak sacrospinalis. Where's the associated point? S2. So we can have him TL that. Bring that back. Okay, now, if we, no, if we take S2, go to its Lovett, okay, if you don't get a change, then adjust S2 with encoded memory, if they have that. If you get a change, then it's actually the primary is its Lovett. I didn't get a change on him for this. Let's give another example. Let's say you got liver, weak pec major sternal, it's strengthened to the alarm point. So you're going to go to T10, right? You will TL, then go to T1. If that negates the TL, see if the atlas negates T1. If it doesn't, adjust T1. If it does, See if L5 negates C1. So that way you get to your primary subluxation. You understand? Similar to what we did for the cutaneous channels. Okay, I'm not going to fix it on you, Gary, because just time-wise, but I will fix that other issue that I thought we were going to find and we didn't find. Okay?
Sure.
Any questions on the primary? Those you all know from the basic course. The only difference there is what I showed you maybe with checking the locus and the spinal agenda. Okay. So now we get to our extraordinary man. And the term extraordinary implies something wonderful, exceptional, rare, and definitely unusual. It is considered in acupuncture that the extraordinary vessels are more primary than the 12 regular. They are responsible for controlling, joining, storing, and regulating the key of the meridians. Now, let's get into how we're going to access them because I'm on limited time here. Negative TL, positive either with TL and rotation of the trunk or lateral flexion of the trunk. Negative TL in the clear, positive with either trunk rotation. Dave, don't do anything to him. Dave, don't do anything to him. I already, Dave? How will you take off your coat and get away from Dave? Now, what do the extraordinary meridians do? What are they known to do? This is very interesting. Remember, what's acupuncture all about? Balance yin and yang. Well, the extraordinary meridians balance yin and yang in the trunk. Now, I had gone through all this, and of course, there's always a time issue, but you have 8 extraordinary vessels. Okay? The left wrist, or the right wrist is yin, the left wrist is yang. Okay? And this is how you fix it. If you find it in lateral flexion, so this would be S1, S2, S3, S4. You adjust the sacrum with encoded memory, check the occiput, it may or may not be there, and then block the cat 1. This is all on the paper. If you find it in rotation, this would be occiput, atlas, axis C3. You adjust that with encoded memory, check its lovett, block a cat 4. Okay? The muscles will only weaken after a stretch. Okay? So if you had a strong pec major sternal, you stretched it, and then it would weaken. Howie, get away from there. Come on. Take your watch off in your hood or your phone. Yeah. And I don't care what anyone says, that diet's working.
Thanks, buddy. It's extraordinary.
So if you know how he is an extraordinary man. Okay, come on up here. Just have a seat. And we roll up your suits. Okay, so check the pulse points in the clear. Good. Now, you know, the thing about the Irish is they always get even. And rotate. And rotate. Rotate your head this way. Good. Okay. I don't find anything.
You just
Rotate.
made him Irish. There's no Cohen.
So we get positive pulse point with rotation. So I get on the right wrist, I get yin kyo mai, which is simply related to stomach, spleen. You can think of it that way, right? So, rotate. Okay, so we're on the classic middle pulse point. Now, touch your stomach alarm point with this hand. Nothing, rotate. Okay. What do the extraordinary meridians do? Balance yin and yang in the trunk. Now, lay on your back. Let these go. Push in. Okay, then what? Stretch. Nothing. Push in, stretch. Okay, so how do we fix it? It was rotation, so that's upper cervicals, right? Right? Occiput, 1, 2. It'd be C2. Does that tell me how to adjust it? No. So I'm just going to kind of, I'm just going to palpate. Oh my gosh. You know, it's good to have a little fun. Touch C2. Push it. Push it. Put your hand on your forehead. Okay. So, think about money. Think about love. And there's self-love, godly love, family love, romantic love, low self-esteem, over-concern. So put romantic love and over-concern into a thought. Some other way. Okay, that's it. Was there an original time? So I'm going to take C2. Is it okay?
Yeah.
And this is, wow, okay. It's really,
Extraordinary.
and it didn't really release the way that I wanted it to. We got part of a release. Bring this up. Push up. Turn your head to the right. Left. Flex. Extend. Laterally flex. Laterally flex. Laterally flex. Laterally flex. Put your hand on your forehead. Yeah, we got part of it. We got the laterality, but not. There we go. Okay, so it was a little complicated. It was lateral, but then it was rotated. It was extraordinary. Okay, so I'm going to stretch. And the stretch reaction is gone. What's the love it to C2? Let's check. Can you TL L4 for me? Be honest. I don't find that. You don't always find a love it lay face down. But there's always going to be a cat 3 if you find it in rotation. So cat 3. Okay, can I have those blocks? Feet together, knees together. Feet together, knees together. Push, push. Okay. Take a big breath. Let it out. Breathe in. What do I do? Sacral inspiration assist while he's being blocked for cat 3. bring it up. Push it, push it, push it. Okay. Now, he may or not have a Cat 1 after that, and he doesn't, okay? So sometimes they'll have a Cat 1 after that, sometimes not. Okay? Okay? Okay, so extraordinary. Again, I'm out of time limit. Negative pulse point, negative rotation, lateral flexion, positive pulse point with rotation or lateral flexion. If it's lateral flexion, it's sacrum with encoded memory. If it's rotation, it's upper cervical with encoded memory. If it's rotation, it's Cat 3. If it's lateral flexion, it's Cat 1. The muscle will display stretch weakness only. Interesting note. What's the main nutrient for fascial flesh?
B12.
B12. If you take B12 and strengthen the weak indicator before you fix this, and you take a strong indicator after you fix this, very often the B12 will actually weaken the patient. Okay, so we're making some deep changes inside the body. Okay? Now, so I'm running out of time, so I'm going to have to skip a lot of the fancy stuff that I wanted to. I swear all these were even when I started, but anyway. The divergent meridians, these are the deepest meridians in the body. And they balance yin and yang in the organs and yin and yang in the head. This is the easiest, but the deepest, negative pulse point, negative head turn, positive pulse point with head turn. The muscle will only display RMAP sub I, repeated muscle activation, patient-induced. Okay. So I know I had.
Got 1 minute.
Perfect. Can I have a minute
All right.
longer? Okay. Now, I'm actually skipping a lot of good stuff, but you have the notes. Have a seat. Okay. So, push up here. Push up here. Turn your head. Turn your head. Have them turn their head both ways because it always doesn't show on just one side. It only sometimes shows one way and not both ways. So have them turn their head both ways. Push up here. Turn your head. Turn your head. Turn your head. Keep it there. Okay, so what I'm finding is the right classic middle pulse point. The way that these are corrected are with high potency miasmatic nocebs. So miasm is defined as a taint or stigmata, either inherited or acquired, which permeates every cell in the body and is then passed on genetically to each succeeding generation. And further, these chronic diseases lie dormant in the body, are susceptible, and can be activated according to our sensitivity. Miasms may be treated homeopathically with high or very high potencies to act upon the genetic code. Dr. Trevor Cook, he was the dean of the British Institute of Homeopathy, and he was my dissertation director. This is my favorite slide of the whole presentation. I want you to read this 3 times. It is now also understood that miasms may be acquired via allopathic medication, blood transfusions, and vaccinations. Okay, I'm going to read it again. It is also now understood that miasms may be acquired via allopathic medication, blood transfusions, and vaccinations. If you haven't seen the movie Vax, V-A-X-X-E-D, I would highly encourage you to see it. You can go to vaxthemovie.com. So it is also now understood that miasms may be acquired via allopathic medication, blood transfusions, and vaccinations. Chronic miasmatic diseases were three originally: cytotic, not goofy, but the gonorrhea miasm, syphilitic, and soric. Then the fourth was added, known as tuberculinic. New miasms would be oncotic, either carcinosinum or schurinum, and vaccininum. Now, no-sodes are homeopathically prepared remedies from disease products. The pulse point therapy localization with head turn will be negated by the appropriate miasmatic no-sode remedy. Guess where all the divergent meridians exit? In the neck. That's why positive pulse point with head turn. That's how you find it. So no-sode, again, is the potentized homeopathic remedy from diseased tissue or the product of disease. It can be used to prevent or treat a miasm as well as for many other uses. No-sodes are the most important category according to Dr. Trevor Cook. So I'll skip that for time. Putting it very simply, this may be viewed as the induced similar symptoms of the artificial disease being superimposed momentarily over the symptoms of the natural disease before mutual elimination, the law of similars in action. And this is really all you need to know. You need to know this one slide. So pulse point 1, that's tuberculinum, the miasm of exhaustion. Pulse point 2, what Dr. Rob has up here, that's metarinum. That is the miasm of excess. Pulse point 3 is carcinosinum or maladaptation. Pulse point 4 is sorinum, the miasm of deficiency. Pulse point 5 is syphilinum, that's the miasm of destruction. Pulse point 6, vaccininum, that's the miasm of chronicity. And then the 7 is schurinum, again, maladaptive failure. So what Dr. Ram displayed up here is positive pulse point here, that is metarinum, and that is the miasm of excess. Okay, so is this, I can't, yeah, but I need these, okay, now, in deference to some lecturers, my strong opinion is you cannot test homeopathy on the tongue. And why is that? If you are a homeopath or have studied homeopathy even superficially, as soon as the remedy touches the tongue, you've treated the patient. So you can test herbs and nutrients and allopathic meds on the tongue if your license allows you to do that for the allopathic part, but not for homeopathy. So what I do is hold it under the chin near the tongue. Okay, you can do it that way. All right, but I happen to know this is the right remedy because I've just done this so many times. Is it okay? And this is a demonstration, so lay on your back. So push in. Go out and in 10 times. What's he doing? Repeated muscle activation, patient-induced. Push in. Push in. Push in 10 times. And across a little bit too. I want you to work the muscles, so across. Now, you'll find all kinds of amazing push in. Okay, now, we could also find that more than likely with the mid-lower trap and lats as well. Hold that there. And push in. So I just check and make sure. There are also meeting points that you can tap while the remedy is here to see if you have the right potency. I'm going to skip that part, trying to make it simple. But most of the time, this is the one. And what do you tell the patient? Please don't have any mint. or mint-like products for at least 3 days. We'll go under the tongue. Okay. Push in, and across, so like 10 times. Amazing. How many here have worked with this divergent meridians? Just, have you guys get like amazing results? Like mental, physical, emotional, all kinds of change? And it takes care of the RMAP sub I. 10 times. If you're not, I highly recommend that you do, that you check this out. Push in. Okay, sit up, please. And it's very, very easy to do and very safe. Turn your head, and the head turn with pulse point TL as well. Thanks. Okay. Now, I don't know what to call these, so I named them the cranial channels because I didn't know what else to call these. This is something new that I have figured out. The reason I call them the cranial channels is because you fix them with either a glabellar fault or a universal fault. So you're going to have negative pulse point. 5 fingers under the left angle of the mandible is the reflex for the adenoid. So it takes a 3-point. Okay. They'll have positive TL touching adenoid with the pulse points. It's very interesting. The muscle weakness will display via strain counter strain. And that's the only way. Check it for a glabellar fault or a universal fault. So either oral or nasal breathing weakens. You've got to do the glabellar fault at least a dozen times. You're not going to get it on 3 to 5 times. At least a dozen times. Check one nostril, or you can challenge for the universal. You need to correct that at least half a dozen times. Let me demonstrate this to you real quick, because I've got a big finish for my cranial man. So bring this up, push up. Let's have the TL first. By the way, Dr. Tony's an acupuncturist, so he knows what the pulse points are. And a naturopath and a gentleman. And a good guy. Okay, now I'm going to, because we don't have enough hands, so I'm going to TL the adenoid point. And we get something. Try the other. Okay, so one at a time. Okay, so what TLs is the right classic distal pulse point, only with TL to the adenoid point. Okay, so what are the muscles related to the metal element when you're back?
That's the fascia lata.
Well, he's already shifting his pelvis. Push out. Push out. Push out against my hand. I don't want you to hold, I want you to push my hand. Okay, now push. Push hard. Push, 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 push. Let it relax. Push. Push my hand. Okay, now push out. Push, 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 push. Let it relax. Push out. So you'll have the strain counter strain. Come on up. Push up. Let all the air out. Close the nose. Close the nose. Breathe in through the mouth. Let all the air out. Breathe in through the nose. Okay, so what's that? Scoot towards me. That's a glabellar fault. We weakened on breathing in through the nose, so how are we going to correct it? Breathing in through the
mouth.
Through the mouth. Is it okay? Breathe in through the mouth. Okay, you've got to do it at least a dozen times. See up, lift, push up, push. I don't want you to hold it. Okay, right here. Okay, lay your back. Just relax. Push out against my knee. Push my knee. Push my knee. Okay, let it relax. Push my knee. Push against my knee. Keep pushing. Push. Let it relax. Push. Real hard. Okay? I have one more thing, but I'm getting the hook off the stage. But if you'd like to stay, I'll be happy to show those that want to stay afterward. Thank you very much for your